Okay, Board Member Pinedo, can you hear us okay?
Yes, I can.
Thank you. Okay, President Joyce, we're all set.
On to mailing D, Executive Director Runyon. Let's practice a survey.
Executive Director Runyon will now cover mailing D, the annual board best practices self-assessment. And this is for calendar year 2025. So just as a reminder, that annual best practices report, it's a state mandated self-assessment where the board evaluates its own governance and management performance against 15 standardized criteria. The Oregon legislature reviews these results yearly, and they're submitted as one of our KPMs or key performance measures to monitor our agency's accountability, ensure effective oversight, and guide decisions during the biannual budget process. These results you see here will be entered into the KPM system, and you'll see them again at the October board meeting. So overall, all the responses were 100% yes, except for questions 1 and 2. And there was a roughly 10% increase year over year, from roughly 80% last year to 90% this year. And question 1.
Sorry, you said question 1, but it was 2 and 3. I think this was 100%. Okay.
Yep.
This is Q2.
Question 2, Executive Director receives annual performance feedback. So obviously we've had some turnover in the ED position over the last couple of years. My performance review isn't scheduled until October and haven't had one yet, obviously. Taking over for interim ED Rosa Klein last year. Scroll on to the next question. The agency's mission and high-level goals are current and applicable, and we had no or one no response to that. And so I think it's a good opportunity to take that feedback and incorporate that into strategic plan discussions in between now and the strategic plan meeting, I believe, in November. And other than that, we received 100% yes response rate from the additional questions. Yeah. And President Joyce, I'll turn it back to you as soon as board member Melvin or staff member Melvin's finished scrolling through. So anyone watching can take a peek at those questions. Quickly roll down.
President Joyce, does anybody have any comments on this process?
As board member Chin, I would just say that, not even having achieved your first year for being evaluated, I think that there have been remarkable changes under your directorship, Gary Williams. So I want to thank you for accepting the position and really working hard to make the changes that you've been doing.
Executive Director, and thank you for those very kind and heartfelt comments. Appreciate it.
As board president Joyce, this is a huge improvement. Chin, I do appreciate your dedication and your hard work. Staff member Melvin, are we ready to move on to the other part of the agenda, or do we have to wait till tomorrow?
No, sorry, it's Member Melvin. You could just keep going down that list.
NABP?
Executive Director Runyon, so NABP. Yeah.
Okay. Back to you, Executive Director Runyon.
Executive Director Runyon and board members Kroger and President Joyce, if you have anything to add after I give a brief synopsis of my experience at the MVP meeting, feel free. Keeping in mind that, you know, what happens in Boston stays in Boston. I think that applies there and all, but, again, I want to express my gratitude for, the board sending me, in addition to board member, or President Joyce, to represent the board and all the Oregonians we serve at this national meeting. The event was exceptionally well executed and the networking opportunities proved invaluable. I enjoyed getting to know board member Kroger and President Joyce a little better, while building meaningful professional relationships with some of the most influential leaders in the pharmacy profession at the national level. As always, I think one of the most valuable benefits of these meetings are often derived from the insightful observations regarding how other states are navigating emerging regulatory challenges, which often provide us with distinct opportunities to evaluate and improve what we do here in Oregon. So I'll go through all the presentations, obviously, that we observed there. I have 3 that I picked from the list, and of course, I'm not going to provide any proprietary information. What I will do, however, is provide some insights or thought primers that I took away from those presentations that could apply to us here. So the first is related to GLP-1 compounding safety and inspection metrics. And this session on GLP-1 compounding safety offered some great context on the influx of counterfeits and adverse events. But what I found most applicable to our work was a broader theme. It highlighted how our inspectors might be able to use raw data to independently assess purity, potency, stability, and sources of compounded samples, rather than just relying on the conclusive summaries provided by the outlets, or in some cases, provided by other entities to the outlets, where they weren't internally generated. They can do this by closely looking at a few specific areas. Just for example, linear degradation. So ensuring stability studies reflect reality. In other words, that chemical degradation doesn't reverse. So if reported impurity levels fluctuate, like dropping and then spiking again, it often points to flawed testing. The second component of that would be API sourcing. So verifying the true origin of raw materials, tracing ingredients back to an FDA registered facility, and watching for red flags like for research use only, labels, or unapproved salt forms. The third component is chromatography scrutiny. So looking at or looking past the final percentage to the actual graphs. For example, overlapping shoulders on a peak suggests an impurity is co-eluding and artificially inflating the purity score. And lastly, purity versus potency, recognizing that both metrics independently matter for safety. A sample might show 99% chemical impurity, but if the potency assay falls below the target, it can still lead to severe dosing inaccuracies. So again, just taking that emerging data and empowering inspectors to utilize this information to independently assess whether or not there are perhaps irreconcilable differences between what's being stated and what's being observed. And the second one involved controlled substance diversion and in-transit loss. So this presentation shifted focus away from internal pharmacy theft, which is typically what we think of, and shifted the focus to analyzing logistical vulnerabilities within the wider supply chain. So think bigger picture DSCSA stuff here, drawing on recent data from the NABP task force on transit losses. According to historical DEA data regarding missing controlled substances, the vast majority of losses occur during transport. Specifically, around 60% of all reported controlled substance losses are categorized as lost in transit. By comparison, employee pilferage accounts for only about 20%. Overnight break-ins accounts for 10%. Armed robberies account for a mere 6%, and customer theft a mere 2%. So this presentation then contextualized last mile cargo theft within the larger transit category. And statistically, these targeted thefts are rare by volume, occurring in less than 1% of the estimated 16 million annual deliveries executed by major distributors. However, these specific incidents involve high value mixed pharmaceutical cargo targeted by organized crime units. The primary vulnerabilities here occurred when driver-owned delivery vehicles are targeted in unsecured parking lots or during rapid cross-dock transfer points. Recommended framework for addressing these losses involves rigorous vetting of common couriers by accredited distributors and utilizing centralized data networks such as the Pulse by NABP platform to facilitate real-time tracking, reporting, and cross-jurisdictional investigation among trading partners. And lastly, a presentation theme that we've seen not only here locally, but nationally and any platform in between is the AI integration into the healthcare chain. And I won't spend a ton of time talking about this, but it's important to recognize that AI isn't new to pharmacy. We've relied on rigid rules-based DUR alerts since the 90s. So that is one way that AI has been incorporated into pharmacy software, into the profession for the last 30 years or so. However, today's emerging AI represents a fundamental shift towards probabilistic models or generative models capable of synthesizing unstructured data as compared to the rules-based DURs. So that's going to force us to reevaluate the regulatory trade-offs between patient access and, in the case of this particular presentation, diagnostic risk. So while modern AI significantly expands access, automating prior authorizations and preliminary telehealth screenings to manage higher patient volumes in historically underserved areas, it does introduce complex clinical challenges. So when integrating AI into clinical practice, for example, we face a critical calibration challenge. Systems that overly optimize for sensitivity generate frequent false alarms that drive alert fatigue, unnecessary testing, and ignored warnings, while systems tuned to minimize those false alarms risk the ultimate patient safety hazard of missing subtle clinical indicators or dangerous drug-drug interactions, for example. So managing these inherent algorithmic limits will be central to the regulatory challenges we face as the healthcare software continues to evolve to integrate AI into these practice models. And that wraps up the highlights from the presentations. President Joyce, I'll turn it back to you to see if you had anything you want to add.
Yeah, sure. Thank you, President Joyce. So I just wanted to share that it was a great experience. I strongly encourage trying to make it for next year's conference in New Orleans. The annual conference will be in New Orleans. So if you're able to get some kind of reimbursement for travel through your employer or through for technicians, it's through PTCB. Maybe check their website to see if there's some kind of reimbursement, travel reimbursement to try to make it to New Orleans next year. Boston is a fantastic city. I thoroughly enjoyed my time there. So when you're there, you're collaborating with like-minded individuals from other states. So I was able to talk to other technicians and how they did things in their states and other board members. And I learned a lot. The presentations were fantastic, and what certain states are doing to be more to serve their communities. So there was a lot of collaboration. I enjoyed the experience, and I strongly encourage, if you're able to, register for next year's annual NABP in New Orleans. I'm sure you will learn a lot, and you will have a good time. Board Member Kroger.
Board Member Kroger, yeah, thank you, Gary, for the high-level summary. It was great to collaborate and get to know Rich and Gary a little bit more throughout the trip. Just wanted to publicly thank both of you for helping me navigate through NABP, being non-weight bearing after a fractured ankle. So I did participate in the resolutions committee, and while I can't necessarily share the conversations because that is kind of an executive session, if you will, type of meeting, was really insightful. And I agree that the collaboration and hearing from other board members, and I almost kind of disagree with you, Rich, on the like-mindedness. I actually feel like I encountered a lot of people who didn't quite think the same as I did. And it's really great to kind of hear those alternate views on whether it's standard of care or immunization practices or the utilization of non-licensees. So I think going to these meetings, and for me, having my thought processes challenged is super valuable. So I encourage all board members, if they have the chance, board staff, if they have the chance, and really just any licensee, to go and to learn and collaborate in this regulatory space. And I think there was some exciting changes within the EC as well, the executive committee of the NABP, I think there's now a practicing community pharmacist on the EC, which is kind of I think a newer thing. Somebody who's really, on the front lines of kind of what a lot of our peers see. So thank you again for the care that you showed me throughout the meeting. And yeah, it's definitely very insightful. And some of the resolutions did not pass. And I think we high level reviewed them together. But it was really interesting to see in those conversations ultimately why it wasn't recommended by the resolutions committee. And when you kind of read them, you maybe understand why they weren't recommended and ultimately didn't pass. But it's a very, if you can participate and volunteer, there's other options. Member forum, I think, is available. Obviously, there's costs associated with all that stuff. But I think the more involvement with NABP, the more education you can get is good for all of us in our positions.
Thank you. On to budget. Is that executive director?
Did you want to start G or you?
Financial update?
Executive Director Runyon. Yeah, we'll group the financial update and strategic plan update into one, as we've been doing for the past few meetings. We'll have staff member Melvin pull up the financial report.
It's E. We have no response.
Executive Director Runyon. So it's after lunch. I won't read through all of these numbers to avoid the risk of putting you to sleep. Nothing really new or novel to mention here. We're just continuing to stay on track, analyzing expenditures and requests to ensure that we're discriminately using resources. So if you look towards the bottom of the page here, you'll see that the cash balance target is, they'll tell you roughly 3 to 6 months. We have 5.63 months listed here. And our projected cash balance at the end of the biennium is significantly higher than that. And this tracks with the numbers that we've extrapolated in the most recent iteration of our agency request budget, as I continue to work with DAS and the LFO on that. It's about 8.6 months and could be as high as 9 months in some of the data that we've extrapolated from that most recent iteration there. So as of April 2026, the agency's total expenditures, which is another thing I look at, are $2,455,734. So if we extrapolate that out, we're based on a linear projection. For this point in the biennium, we're about 7% under budget as compared to where we could be. And that's all I have on the financial portion. Again, nothing novel to mention here. Is business as usual. And as far as the strategic plan updates go, I'll give you an overview of a lot of the things that we're doing at the agency level, the majority of which fall into one category or other within the board's strategic plan for the 24 through 29. The key milestones since last meeting, as mentioned, we're in strong financial standing, and the 27-29 CSL or current service level budget has been successfully submitted, with the agency maintaining an exceptionally healthy cash balance and a firm commitment to zero surprise fee changes, especially, but there shouldn't be any surprises in the budget. So that's my commitment, not only to you, but also to licensees and registrants writ large. We have a couple of revenue neutral POPs that I've included some information about in previous reports. POP 1 or 101 would include a vacant management position that's being abolished to fund 2 new frontline administrative roles, one in the compliance department and one in the licensing department. And essentially, this is me investing in the agency and taking away the strategic initiatives manager, what's otherwise known as the executive assistant, and reallocating those resources where I feel like it's most needed and appropriate. Even though I would love to have an assistant, I think we could use that help elsewhere. So that pop is looking really promising and excited about the impact that that could have on the agency. Not only on the workload, but also how we interface with licensees and the efficiency with which we process their applications, their requests, etc. So I think it will reallocate resources in such a way that'll make it easier for us to do what we need to do and make the working environment as positive as possible and as relaxed as possible, given the gravity of the work that we do, of course. In the staffing reclass is in POP 102 or 2, and it would take 2 existing roles and essentially reclass those to accurately reflect their scope. And going forward, as mentioned, the ARB or agency request budgets due at the end of the month alongside our affirmative action plan, both of which I'm currently working on. Moving forward, I'll break down the additional key actions by operational in nature, those that are operational in nature, communications, presentations, and travel. And then I think I have a miscellaneous one at the end. So in terms of personnel, then the licensing department, we have a full-time licensing rep that starts next week. We have approval for a limited duration employee that would be an office specialist, essentially a front desk individual, if you will. That position's approved and recruitment for that's materializing in the compliance department. And loosely working with compliance director Efremoff to get the vacant healthcare investigator advisor position posted very soon. I'd like to have some tangible movement on that before next board meeting. To be clear, that doesn't mean someone's hired before next board meeting. It just means we have a clear vision of what we want that to look like and have made some tangible progress in terms of the recruitment or getting that posted. And as far as the executive department goes, and the strategic initiatives manager is an executive assistant, even though that's being abolished next year, I think get a limited duration or a 1-year approval for that. We had in-person interviews on site Monday and are therefore in the final round of recruitment for this position from a field of well-qualified candidates. So I'm hopeful about the impact that they can have over the next year in terms of helping reduce workload for me so I can free up for more specialized tasks within the agency, but also from the perspective of them being able to be cross-trained so that they can help out either the licensing or the compliance department as applicable. And from there, we'll go on to the communications, presentations, and travel updates. And before I dive into some of the great work we're doing in terms of outreach and education, let me first say this. We won't change the world with a keyboard, and we don't build relationships by hiding in the office. And I'm talking about the ED role here, not anyone else, just to be clear. I'm talking about myself. And this just underscores how important I think these efforts are. In fact, I think our investment in this revised approach to outreach and education is one of the biggest reasons that we've seen such a big and positive shift in terms of our relationships out in the community and the magnitude of engagement and feedback that we've seen. And you've seen it yourselves. I've heard more than a few people say how surprised they are today about the feedback that we've gotten, just the volume of the feedback, but also the quality of feedback as it pertains to, or as it is exemplified by the compounding survey return, the PPL return, etc. And I see those as intimately related to what we're doing out in the community. I see our presentations as a cohesive unit. So even when there are instances where we're given a law update, and that might seemingly be unrelated to a pharmacist prescribing update, I take a step back and see how there are so many points where those do overlap and where we can use that synergy to increase the impact of what we're doing, regardless of what we're presenting on, just to increase that resonance or that buy-in out in the community. Since the beginning of the year, I placed an increased focus on embedding opportunities for polling the audience. Not always the most popular thing, but I do derive a lot of value out of that. And it, it wakes people up in certain instances. So, and I do it to get a pulse on the impact that we have out in the community. Is there a difference between what we want to do and what we think is happening and what is actually happening? And I can tell you, I've been surprised this year. The more that I've incorporated that into the presentations, the more I've noticed a trend emerging. We have a lot of tools that are available for our pharmacists to utilize, but the uptake is much lower than we would hope. And this begs the question, what are the barriers? The questions are two, and how can we surmount them? I feel like addressing these issues now is of cardinal importance for a few reasons. Number one, it'll increase access to care. Number two, it might help potentially remove barriers to someone practicing at their, and I'm using air quotes here, education, training, and experience. If a standard of care model is ever adopted for Oregon pharmacists, and we already know there are individuals working on this in the state. And number three, it might help increase the uptake or the utilization of the MOD protocols that we've worked so hard not only to get passed from the state perspective with Senate Bill 236, but also getting passed through the PFAC and then the board and then out in the community. Of course, we're still just waiting on the DA to update their chart of mid-level providers to include Oregon pharmacists so they can register for the DEA number or registration. But I think all of this and all of these efforts will help increase the uptake of that once we finally get the green light here. So all of that to say, I think a presence out in the community in this outreach and education, it's not just simply about giving people the information, it's about giving them a reason to care about the information you're giving them, right? And don't just tell, compel. That's my 2026 slogan. You might even see me wear it on the shirt around the office. But that's where I think we have the biggest opportunity to make the difference, and a difference that I've seen ramifications of in a positive way after having gotten feedback from being at these various conferences. So in terms of communications, I have a couple, or actually just wanted to mention, OHA brought to my attention that there may be some opportunities for pharmacists to play a role in increasing access to MMR vaccination, specifically for the purposes of post-exposure prophylaxis, where per ACIP recommendations, the MMR vaccine can be given within a 72-hour window following exposure. We should have a communication out this week or by end of day tomorrow on that. And a couple other presentations unrelated to travel. Number one, I was asked by Executive Director Nicole Krishnaswamy from the Oregon Medical Board to provide a short presentation on our MOD protocols to the monthly meeting for health professional regulatory boards. The presentation went well, and there was some sustained interest afterwards, and I feel there's some good opportunities that will precipitate from that. And I did that, I think, at the very end of May, maybe end of April. And the second presentation, I was asked by Savannah Santarpio from the State Overdose Prevention, Injury and Violence Prevention Program to present the Board of Pharmacy's MOD protocols to the Regional Overdose Prevention Coordinators at their monthly meeting on June 3rd. And it's a group of incredible local resources for all of the things that are related to substance use and substance use disorder, or that are within the overdose continuum, if you will, together. And it presented some opportunities to engage, or they presented some opportunities to help us engage community pharmacists about our protocols once they come out. And I gave a statistical overview of the scope and magnitude of this problem, and in keeping with my don't tell, compel theme for the year, really just distill that down into how that relates to empathy and how I think we are all impacted by this condition, whether or not we realize it. And so that's one of the things I'm focusing on out in the community as well, is just trying to thread together all of those kind of subtle and often almost indiscernible ways that this affects all of us. and unearth that empathy that's there. These pharmacists care about this issue. They just may have forgotten. So I think that's where we have the biggest opportunity in what I'm doing with these presentations, and why it's so encouraging to see other people reach out to me, because they've had other people reach out to them saying, hey, this individual, this ED at the BOP, they, seem to care about substance use disorder now, or opioid use disorder. I heard them speak at this one, on this one platform or at this one event, and it really changed my mind about what they're doing. So there's been a sort of synergy there, where one person invited me to speak because another person had invited me to speak, and so on. So I'm really encouraged by what I'm seeing in terms of the us being received and our efforts being received out in the community. And so I think doing all that work on the front end would be really important prior to the protocol, or prior to the pharmacist being able to register with the DA number. I think there's been a perception for a long time that our work is done once the protocol rolls out, but I think I see the opposite. I think our work just begins as a profession, specifically once the protocol is rolled out. And I see the opportunities where, as regulators, also using the authority and the communicative synergy and the relational synergy we have through the board itself, that our work can begin at that point as well. It doesn't stop once we, post that on the website. As far as travel goes, and I'll quickly wrap up here. As far as travel goes, obviously we just talked about the NABP conference in Boston, and appreciate being sent there. Since the last board meeting, I attended the OSHP annual seminar in Sun River, Oregon. I'd like to thank OSHP for their hospitality, and overall it was a successful and fruitful event, and we were honored to have been included. Again, as we continue to build relationships and trust out in the community. On the first day, I kicked off the presentation portion of the meeting by presenting a pharmacist prescribing update with PFAC Chair Courtney Sellers. We set up an exhibitors table that afternoon and attended a welcome reception later that night. I also presented a law update on the last day with Compliance Officer Jane Lee. And somewhere in between all this, I won the honor of receiving the first annual pie in the face, delivered by none other than Compliance Officer Jane Lee. And Officer Lee, if you're listening, don't worry, this will in no way show up in any of your quarterly evaluations moving forward. It was a great event, and I look forward to doing that next year as well. And then to wrap up the summer tour, I ended up in the Northwest Pharmacy Convention in Coeur d'Alene, Idaho. If I'm not mistaken, this is the first time the Oregon Board of Pharmacy has presented or had a formal presence at the event. Presented an Oregon Pharmacy Law Update, and several members of OSPA were in attendance, and appreciated getting to spend a little more time with them. Not only did I receive some great feedback about the presentation itself, an ED from a neighboring board provided me with some candid feedback that she overheard as she attended a pharmacy technician meeting. She said that there were some technicians present that shared that they were, quote unquote, hopeful about the direction the Board of Pharmacy was headed in, and that they haven't felt that way in a while. They felt that when the inspectors come on site, they're there to help, not just for the purpose of finding things wrong. And to me, that's encouraging to hear, especially in a closed setting with no board representation, when the individuals speaking were not reasonably aware that that information would get back to us. So again, I think it's a testament to the importance and impact of what we're doing out in the community as it relates to outreach and education. And with that, that wraps up the strategic plan and financial update portion. President Joyce, I'll turn it back over to you.
President Joyce, yeah, you've been a little bit busy, huh? Question on the any news on the software update, like where we're at, how far along, or when that's
That's why there's still money in the budget.
Thank you, Dr. Runyon. So at this point, I think one of the last touch points you probably would have been notified of is the potential sunset date of December 2026. That's been extended, so we now have a contractor bridge through, I believe, the end of June 2027. So we have a little additional time to use the software that we have. Currently, we have that expenditure probably parsed out for Q8 of this biennium. There's still some project management elements that we're trying to get taken care of, or hoops, administrative hoops that we're trying to jump through in order to get this approved in the way that we want. So I know that's a kind of a non-answer, but I think in the next month, especially getting this strategic initiatives manager or executive assistant position in-house, again, in the final stages of the hiring process there, I think that will help us free up some time to where we can focus solely on that, while the things that I'm doing that really, I say everything falls underneath my job title. Things that I'm doing that other people could do will allow me to focus on that. So hopefully we'll get those submissions in within the next month, and we'll know what other parts of the timeline will look like once we get a determination from that submission.
Yeah, thank you. Yeah, software updates always make me nervous, having worked in hospital systems, and anytime we switch electronic records and systems, it can be a mess. And then so with the timing of that and, us eventually moving into MPGE, right? And I just don't want to, obviously we want to try to avoid any hiccups. And then any word on the open board position for public or pharmacist and whatever?
Oh, Executive Director Runyon, I do have an update on the somewhat of an update on the public position. I do have that scheduled to chat about tomorrow during the annual business meeting portion, because I have some PFAC updates as well. If you'd like for me to discuss that as part of that, can leave this tomorrow if you want, but I do have an update for you there.
And yeah, thank you. Thank you for all your work. We really do appreciate it. Your hard work and man.
Member Cookbride, so you mentioned Q8 of the biennium. I'm assuming that's like the end of the biennium. Is there any chance of like a use it or lose it situation where we had the budget approved? And these things notoriously go long. It's a big project. That if we're waiting to Q8, if we don't make that expenditure, we might have to start the process over to get approved, or is the money ours and waiting for us no matter what?
Executive Director Runyon, very good question. I would say it's ours. I would say no matter what, but it is ours. There would just be another hoop to jump through in requesting that allocation essentially be moved to the AY 29. And we've already covered that potentiality in discussion about the budget. I hope, fingers crossed, that it would be a lot sooner than the end of the biennium. That's just where we've parked it now. Knowing that every touch point along the way, even before I started, well before I started, there were delays at every increment. And so that's just kind of a fail-safe. And if things don't work out, kind of contingency plan in terms of allocating that for Q8. But there would be the opportunity for us to roll that over essentially, so we won't lose it by any means. Also with inflation, obviously, we don't, the sooner we can get this locked down, the better. We don't want the price to go up as a function of those processes are outside our control.
Did you have anybody else have any comments or questions? Let's do financial
What kind of
update.
pie did you get in your face?
I tried to request a certain type, right, as if I had no control over that. I asked for, I think it was a boysenberry maybe,
There you go.
or
Very
Marionberry,
specific.
yeah. But coconut cream was all they had. And I think if you were to wander over, this is hearsay, if you were to wander over to someone's cube, that there may be pictures of it over in the agency. I haven't seen them, but
The confirmed alerted eye, huh?
yeah.
For the additional detail.
I think I mumbled et tu, Brute, when she was throwing it in the face, but I don't think she heard that.
Thank you, Gary, Executive Director Ryan. We can't go over the consent agenda today. We can today?
Absolutely, yes. Consent agenda and matters to be discussed by the board
We
could.
can do that?
Mhm.
Okay. Right, is there any board discussion on the consent agenda? Board President Joyce, no. Board Vice President Kirkbride?
No.
Board Member Hall?
No.
Board Member Kroger? Board Member Pineda?
No.
Board Member Smith?
No.
And board member Patel.
Board Member Patel.
I didn't have her on there because this was gonna occur tomorrow and she was.
Exactly. Yeah, that's fine. No. And then board member, Shen. It's also not on there. Okay.
I took you guys off. You're not supposed to be here.
So I'm gonna go ahead and, motion the consent agenda. Is there a motion to approve the consent agenda as proposed? Is there a second? Board member Smith. Board President Joyce, yes. Board Vice President Kirkbride.
Yes.
Board Member Hall.
Yes.
Member Kroger.
Yes.
Board Member Pineda.
Yes.
Board Member Smith.
Yes.
Board Member Patel. And Board Member Chen.
Yes.
On the list. Let's see, okay, can go ahead and, go over matters to be discussed. With each board member, I'll start with, Board Vice President Kirkbride, who wanted to talk about any matters to be discussed.
I don't have anything on my mind today. Thank you. I'll pass it to the next board member.
Board Member Patel,
Board Member Patel, I don't have anything to discuss, but I would like to give my speech.
Go for it.
3 minutes, my last speech. So, as I concluded my service on the Oregon Board of Pharmacy, I have spent some time reflecting on what this past 4 years have meant to me. Serving the people of Oregon has been both an honor and responsibility that I have never taken lightly. Every vote, every discussion, and every decision carried consequence for patients, pharmacists, technicians, and the public we are entrusted to protect. When I joined this board, I did not come here expecting everyone to agree with me. In fact, I believed my role was not to fit comfortably into the conversation, but to contribute honestly to it. Throughout my term, I have asked the questions, challenged assumptions, and occasionally take positions that were not always popular. I understand that disagreement can sometimes create discomfort, but I have always believed that respectful disagreement is not a weakness of good governance. It is one of the greatest strengths. The best boards are not made up of people who think alike. They are made up of people who are willing to listen, willing to challenge one another, and willing to consider perspective different from their own. In recent years, we have spoken often about diversity. Diversity matters, but the true diversity is more than demographics. It is also diversity of thoughts, diversity of experience, diversity of perspective, and the courage to express those perspectives even when they are in the minority. It is easy to welcome differences that are visible. It is harder and far more important to welcome differences that are expressed. I would like to thank you, my fellow board members, for their service, commitment, and dedication to the people of Oregon. We did not We did not always agree, but I believe our differences made our conversation stronger and our decision more carefully considered. To our licensees across Oregon, thank you for the work you do every day. Whether in community pharmacies, hospital, long-term care facilities, industries, education, or other practice setting, you are the face of this profession and the reason this board's work matter. Your dedication to patient care and the public safety deserve recognition and respect. Public services requires more often participation. It requires independence. It requires the willingness to ask the difficult question, and especially when the answer may be inconvenient. It requires the courage to speak when silence would be easier. As I leave this board, I remain proud of the fact that I stayed true to those principles. I live with no regrets. I said what I believed needed to be said. I asked the question I believe needed to be asked. I did so with a sincere commitment to the mission of the board and the people we serve. My hope for the future is that this board continue to embrace not only variety of backgrounds, but also variety of viewpoints. Because institutions are strongest not when everyone thinks the same, but when people feel free to think independently and contribute authentically. Thank you for the opportunity to serve. It has been an honor, and keep up the good work. Thank you.
You. Thank you very much. Board Member Smith.
Board Member Smith, that's all about to follow, but thank you for your. No, nothing bad today. Thank you.
Member Kroger, nothing to add.
Member Chin, nothing to add.
Member Hall.
Nothing to add. I just realized earlier that this was, Board Member Patel's last meeting, so that's kind of sad, but I'm happy I got to work with you.
Member Pineda.
Board Member Pinello, I am so glad I'm not there because I totally would have cried in person. Thank you for being the person that has an opinion. You know, I respect your opinion. I expect your advice and everything that you have said during the last couple of years. I wish you the best. I'll stop by and see you when I travel over that way.
Well, thank you.
As Board President Joyce, no, thank you very much, Priya, for your commitment to the board. And I've always, appreciated your voice because, and more diversity, the more, I appreciate people's experience on the board and the diversity on the board. And I'm, very appreciative of the fact that Oregon has, the Oregon board is a diverse group. And we have 2 technicians, 2 public members, 5 pharmacists. A lot of the other boards, their makeup I didn't see that much diversity as far as, their backgrounds, but most definitely have appreciated your voice, Priya. So thank you. Can we do anything else today?
So you might just state no matters to be discussed by agency.
Yeah, Executive Director Runyon. I think staff member Melvin's looking at the agenda to answer the question. I'm getting
I think everything else
Yeah,
has
head shake.
until
Yeah.
tomorrow.
So it matters to be discussed by agency staff,
Yeah, we can do that.
if any.
I don't have any other than a thank you to Board Member Patel. I really appreciate the words that you just shared, and it's been a pleasure getting to know you, and I appreciate the influence you've had on the board, the impact that that's had on licensees. And I think more importantly, on a personal level, just getting to know you, it has been very kind to me when I was, I want to say a WE compliance officer, a young,
6 months ago.
untenured, that is what I mean by that. Individual that's trying at the board, you're very kind to me and very supportive of me in this role. And it's been a pleasure getting to know you. And I appreciate all you've done and look forward to seeing what you continue to do out in the community beyond this. Thank you.
All right. I think everything else has to wait until tomorrow. So on that note. Okay, for you, adjourn, all right? Okay.
The president.
Yeah. And we are looking at, of course, 8:30 tomorrow and,
Will we have some time before that to do our board
Yeah.
tickets?
oh, yeah, I mean, go ahead.
Step member from, they are, motions are almost, the template page is almost ready. It should be coming over any minute.
Oh, awesome.
So you could hand that out today and then pull them back, or if you wanted to try to take some today, or if you need time to do other stuff, I don't know what
Yeah.
the idea is or how, what's permitted to be done.
Any, strong feelings, whether you guys,
I don't need it.
I mean, we get the,
Do you guys do the motions today?
Whatever, I.
No.
Whatever you
do
guys
the
want.
motions today, or do you guys, I don't know. I'm not. comfortable with
Rebecca,
that.
right, I'd rather do the motions tomorrow, but
Yeah.
I'd like to do the, if you're offering that we can make our notes today and then hand them back in, I would love to do that, so I don't have to do it in the morning.
Let's do that. And, yeah,
Can we then adjourn the meeting? You'll have to be on meetings.
to do that, okay. Yeah, let me.
The
let me-
senior AAG says yes.
Yeah, I wanna- You've only asked every single time. That's
Awesome, the AAAG.
President Joyce, it's page 17. Can you? At the bottom.
Is there a motion to move to adjourn the meeting at 3:09? Excuse me, 3:07 PM?
Board member Chin.
For a second?
Second
Board
board.
member Kirkgrave.
Board President Joyce, yes. Board Vice President Cooper.
Yes.
Board Member Chin.
Yes.
Board Member Hall.
Yes.
Board Member Kroger.
Yes.
Board Member Patel. Board Member Piano.
Yes.
Board Member Smith. Yes. Motion passes.
Thanks, everyone.
Be here tomorrow still? Okay.